right, I think we're going to go ahead and get started. As you can see from the screen, a couple of quick reminders that we don't use the chat function for these, and we don't use the raise hand function. We use the Q&A function. So if you have a question, please put it in the Q&A box. If you have a resource that you want to share with people, you're welcome to share that in chat. But for questions, please use the Q&A box. Just as a reminder for those of us who might be joining us for the first time, that this is a webinar for the UW School of Public Health community. And while anyone is welcome to, at UW is welcome to watch it, that the guidance that we're offering is for faculty, staff, and students who are primary in our school. So if I or any of the other folks on here refer to policies or recommendations, for instance, about work practices, keep in mind that those are for people primary in the School of Public Health. And if you have questions about whether or not they apply to you in your workplace setting, then you should talk to your supervisor or the director of your unit. So it has been 3 weeks since our last weekly webinar. A lot has happened since then. Last week, we canceled all meetings, administrative meetings on Wednesday to observe hashtag shutdown academia, a protest that was organized by folks across the country to show solidarity with the Black Lives Matter movement. And the week before that, the health science schools all gathered together at the same time as our weekly webinar. So we also canceled the weekly webinar. That was to have a conversation across the 6 health science schools in the aftermath of the death of George Floyd, and to start conversations about what we can do to promote anti-racism in our schools. Starting next week and throughout the summer, we'll be cutting these weekly webinars down to 1 hour from 3 to 4 p.m. We may have some rotation in terms of who's hosting them. I wanted to give you a heads up that next week we will be having our launch of our strategic plan, and Jared Baton, Vice Dean for Strategy, Faculty Affairs, and Strategic Initiatives, will be hosting that webinar, again from 3 to 4 p.m. And that was something that we had planned on doing originally, I believe, last week, and that got postponed. And then the other topic that we had planned for last week was, and perhaps even the week prior to that as well, was to do our awards of excellence for the school, and we're going to do those today, which is exciting. In addition to doing the Excellence Awards, we have our sort of standard roster of panelists with us today: Janet Baseman, who's Associate Dean for Public Health Practice and Professor of Epidemiology; Stephanie Farquhar, who is Acting Associate Dean for Education and a Clinical Professor in Health Services and DEOHS; Lisa Manhart, who's Associate Dean for Research and a Professor of Epidemiology; Victoria Gardner, I believe, is joining us, Assistant Dean for Equity, Diversity, and Inclusion; Uli Haller, who's Assistant Dean for Finance and Administration; and hopefully Juanita Ricks as well, who is Director of Operations for Student and Academic Services. So we'll come to updates across the board from everyone after we do the Excellence Awards. But with that, I'd like to just go ahead and launch into the 2020 SPH Awards of Excellence. I would like to acknowledge, as we lead into this, the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, Duwamish, and Muckleshoot nations, where not physically at the University of Washington this week, but most of us are still on their land as their guests here today. The work that all of the great folks that we're going to tell you about today would not have been possible without them allowing us to be guests on that land. So each year, the school, its departments and programs, and the Student Public Health Association recognize exemplary staff, faculty, and students for their dedication, service, and many contributions to our school. We usually host an in-person event at the UW Center for Urban Horticulture and celebrate the great collective work of the school. It's sort of one of our end of the year celebrations. But this year, like our graduation celebration, the Excellence Awards have moved online. You may have seen the lovely 2-minute slideshow that we sent out last week announcing the winners. And today we're gathering to say congratulations to all the recipients who I will introduce you to via video shortly. Although today honors individual awardees for their exceptional work on behalf of our school and the communities that we serve, today is a day everyone can feel proud to be a part of the school where so many people are making such a great positive impact. If this recent season has shown nothing else, it's highlighted our collective resiliency, tenacity, ingenuity, and commitment to public health. We appreciate all of you who remain steadfast in your commitment to teaching and learning, to research and practice, and to serving the community and each other. So with that, we're going to go ahead and share. I see someone's raising their hand, and I would ask them that they put their question in the Q&A box because we don't use the raise hand function in these. And Elazar is going to go ahead and share a 6-minute video honoring our awardees.
Hi, my name is Ule Haller. I'm the Assistant Dean for Finance and Administration for the school. It's my great pleasure to welcome you to this year's SPH Excellence Awards, the virtual edition. We'd like to start with the Outstanding Staff Awards. Each year, the departments and the Office of the Dean name outstanding staff. All staff are eligible for this award, whether classified, professional staff, or in some other category. Each department reviews the nominations and selects the winner. Criteria often include job knowledge and performance, creativity, integrity, flexibility, positive attitude, willingness to go beyond limits of the job description to get the things done, community service, outstanding interpersonal skills, and demonstration of grace under pressure. This year's recipients stand in line with a number of other past winners. These are our go-to colleagues, referred to as a joy to work with. They're responsive, fabulous colleagues who go the extra mile, create collaborative working environments, who are dedicated, patient, and valued, colleagues who stepped up, were the right hands to everyone. Their dependability, ingenuity, and dedication are equally complemented by their steadfastness. During these incredibly difficult times, because of their exemplary work and dedication, their countless contributions, we as a school continue to provide students a high-quality, unique, and unforgettable learning experience. We continue to demonstrate the highest levels of professionalism and integrity, providing support to one another, and continuing our research efforts and service. Thanks to all of you for your outstanding support, supporting students, faculty, and staff. Please join me in congratulating all of the recipients. In addition, these outstanding staff members are now nominees for the Anderson O'Connell Award. The Anderson O'Connell Award, initiated by former staff team member Gene O'Connell, was created to honor Ken Anderson, the school's first director of finance and administration, for his long and extraordinary service to the school, and to recognize current staff members who show kind of dedication that made Ken such a wonderful role model. This year, it's my great pleasure to announce that the winner of the Anderson O'Connell Award is Cindy Loudon from Biostatistics. Please join me in congratulating her in addition to the other outstanding staff members. Now I think I'm going to turn it over to Stephanie Farquhar, the school's acting Associate Dean for Education. We'll walk through the Student and Teaching Awards. Take it away, Stephanie.
Thank you, Uli. I'm Stephanie Farquhar. I'm the Acting Associate Dean for Education, and this next group of awards are incredibly meaningful to the students. Each year, the Student Public Health Association works with students to recognize individuals within the school for their contributions to elevating the student experience. The Student Community Service Award recipient shows dedication and commitment to community service and volunteerism by building bridges between the school and the community. The Service Award for Community Partners acknowledges a community partner who has demonstrated a commitment to promoting social justice and public health within Seattle and within the learning community at the School of Public Health. And the Outstanding Teaching Awards include recognition for outstanding teaching assistants, Outstanding Distinguished Faculty Member for Teaching Award, an Outstanding Distinguished Faculty Member for Mentoring. Thank you to the Student Public Health Association for coordinating these awards, and a big congratulations to each of the recipients. It is indeed a testament to the value you each bring to the student experience. And now our student recognition, Outstanding Student Awards. The graduate students from across the school, as well as undergraduates in environmental health, health informatics and health information management, the food systems, nutrition and health major, and from the public health global health major are recipients of the Outstanding Student Award. The departments and program have their own procedure and criteria for selecting its outstanding student, which includes students' academic contribution to the field of public health, students' commitment to public health beyond their research, such as engagement with the community, and students' potential for leadership in public health. These exemplary, talented, hardworking students are skilled and creative. Not only are they innovative, they are also award-winning authors, good communicators who are dedicated champions of public health, and they can be found teaching, volunteering in the community, and leading by example. They are promoters of equity through scientific discovery. Collectively, they have a productive history of research and community-based practice, and they are domestically and globally forward thinkers, rising stars with a very strong sense of purpose and service. We are extremely proud of each of these students. We wish them continued success.
Okay, it sounds like Stephanie might have gotten cut off there. But thanks both Stephanie and Uli, and congratulations to all of our outstanding award winners. Now I'm thrilled to announce the recipients of the Gilman S. Omen Award for Excellence, which we call the Omen Award, which recognizes outstanding achievement by one master's student and one doctoral student in the School of Public Health. These individuals are recognized because they excel in scholarship and have demonstrated a commitment to the field of public health. This year, both recipients are students in the Department of Epidemiology. Please join me in congratulating Michelle Buterres, who's an MPH student in epidemiology, and Vivian Lyons, who's a doctoral student in epidemiology. Before I close today's webinar, I also wanted to share with you the award recipients for communicating public health to the public. This year, communicating accurate, timely information, sorting fact from fiction, and giving the latest and best insights without causing panic has been more important than ever. This year, we're recognizing 5 individuals who spoke up early and often when we first learned of the pandemic, and who went out of their way to communicate with media after hours, on weekends, and between classes. They help to make sense of the overwhelming developments and conflicting information, and we thank them for their tremendous contributions. I'd also like to thank the many other faculty members, students, and scientists who have stepped up to share their expertise, either writing op-eds, giving interviews to journalists, or speaking at webinars, who have done so much to promote public health while also raising the visibility of the school, its departments and programs. A huge thanks to all of you. Finally, it's been our tradition to recognize the winners of the Health Policy Brief Writing Contest, which is an annual writing competition sponsored by the Center for Health Innovation and Policy Science, or CHIPS, for students who are enrolled in a health services degree or certificate program in health services offered classes within the previous 12 months. Created in 2019, the purpose of this contest is to encourage and solicit high-quality writing and visual communications that are appropriate for policymakers in the form of a health policy brief. The winning submissions receive a cash prize and the Aaron Katz Award for Excellence in Health Policy Writing. This year's winners in first place are Carolyn A. Fan, and in second place, Madeline Frost. And that concludes our award celebration. Congrats to everyone, and I invite you all to stay with us as we go over some of the latest information on COVID-19 and how it pertains to our school. Which is a great segue into something that just has come up in the last day or so, which is that I heard from several folks concerns about an interview that I had done. And I just wanted to say that I appreciate everyone who reached out. Part of what we value in the school is people being able to communicate openly and honestly when we're not happy with each other. You've probably heard me say before that one of the things that I have found most challenging about Seattle is when people abide by Seattle nice and don't call each other out when they're not happy with what they've done. So I really appreciate hearing from people who did not like what I did and brought it up in a really constructive and helpful way. So in case you're wondering, what is she talking about? What I'm referring to is that a couple weeks ago, I did an interview for Breitbart Radio on COVID-19. And I actually had forgotten about it, but it was in the newscatcher, and a couple of people saw it in the newscatcher and were like, what the heck? Why are you doing an interview with Breitbart? And so I think it's worth talking about what my motivations were, but also acknowledging that this is not the time to be even appearing to support organizations that are anti-racist. So why did I accept the interview with Breitbart Radio? First of all, the interview, which you guys are welcome to listen to, it was one about COVID-19 and specifically issues related to why the response to COVID-19, particularly adherence to wearing masks and social distancing, why that has become politicized, and concerns raised by the people who are conducting the interview at Breitbart, who, interestingly, because I was surprised to hear this perspective, felt like the people in that community were not getting accurate information about COVID-19, and as a result were not adhering to social distancing constraints. And I have to say, when they first reached out, Jeff will confirm that my immediate reaction was, no way, I'm not doing it. And I thought about it for a while and decided that it was important, given the stance that I have frequently taken about the importance of us engaging in conversations with people who have different perspectives than we do, and than I do, on issues, the importance of engaging them, and particularly around COVID-19, and adherence to social distancing, where I think all of us have felt enormous frustration that there seems to be a divide in this country in terms of who is adhering to social distancing constraints and who is minimizing the risks of COVID-19. And so it was with that and the desire to communicate to an audience that I don't normally talk to, and to a segment of society that I don't normally engage with, and probably most of you guys don't engage with on a regular basis either, that I agreed to do that interview. And I have to say I was probably more nervous about doing that interview than any interview I have ever done. And I was surprised, pleasantly surprised by the questions that they asked. They had given us a list of questions ahead of time, and Jeff and I were very careful to screen that they were actually just asking questions about COVID, not asking political questions, and that it wasn't some sort of trap. Yeah, so anyway, I would say overall I was pleasantly surprised and came away from it feeling like it was a good opportunity to demonstrate commitment to trying to improve the health of even those segments of society that whose values we don't share. So anyways, that was the reason for it. The couple of emails that I've received so far have been from people who have rightfully spoken out against the values and felt like that by participating in that interview that somehow I was endorsing that organization and their values, which in no way, shape, or form was the case. But I do understand why people interpreted it that way, and I'm sorry that people were hurt by that or felt that that somehow misrepresented our commitment within the school. And so I have asked the communications team to take down the link from the school website to the interview. Like I said, this happened several weeks ago. And I'm also happy to continue having conversations with people. I mean, I still do want us to continue having conversations across the political aisle and where it can be productive, engaging people who are in different places than we are. In this particular case, around COVID-19. But I do absolutely understand why people not knowing that context or even knowing that context are not happy about it. And like I said, do apologize for people who felt like it was not consistent with our anti-racism stance. And for that, I am sorry. So with that is a great segue into our Common Book announcement, which is that our health sciences Common Book is How to Be an Anti-Racist. And I think you guys appropriately called me out and said, walk the walk, that if you're going to be an anti-racist, say, I don't like those values. And so I appreciate that they were trying to get information out, real information about COVID-19. I don't like the other values espoused by that organization. So this does give us an opportunity to have lots of these conversations over the coming year. I think, you know, in the different meetings and follow-ups that we've had a lot of discussions about having universal anti-racism training, about what different steps we're going to take. And I think all of us agree that this is a moment in time that we should capitalize on to really make some substantive change within our own organization. A lot of that substantive change is not going to come with just one training or one conversation. It's going to require ongoing conversations and continuing to push each other, like you guys are pushing me. So what's nice about the Health Sciences Common Book is that it provides a platform for doing just that. So it's a way of having an ongoing conversation across our school. If you have not read it, I would highly recommend it. So it's written by OBrien, who is one of America's foremost historians and a leading anti-racist voice. He's been #1 on the New York Times bestseller list and founding director of the Anti-Racist Research and Policy Center at American University in Washington, D.C. And one of the key points of the book, like I said, very relevant to this conversation, is that it's not enough to just to be against racism. You actually have to speak out against it. So point taken, and I will endeavor to do better. So stay tuned for more conversations about this book. I encourage each of you, if you haven't read it, to pick up a copy and start reading it over the summer. It's a good segue into many of the conversations that we will continue to have throughout the year. Okay, so other updates in terms of COVID-19. Since we last met at our webinar 3 weeks ago, there have been more than 2.5 million additional cases of coronavirus across the globe and nearly 100,000 additional deaths. This brings us to 8.2 million total confirmed cases globally, with global deaths totaling more than 445,000. And our hearts go out to those who have lost loved ones. Brazil has had more than 900,000 cases, and Russia more than 500,000. India's total cases have now doubled since our last meeting, now topping 350,000. China has recently reported new cases in parts of Beijing, which had gone 56 days without a new case, and they were just put on lockdown again this week. And New Zealand, which went 3 weeks without a single active case and appeared to have gotten past this, is now reporting 2 new cases from people who arrived recently from the United Kingdom. All of this illustrates the challenges that all countries face as they reopen. The virus clearly isn't going to just go away or stay away. Many experts and modelers are predicting a major second wave of infections in the fall, and I think we're all in this moment also struggling with how do we prepare our own work and school environment to be resilient to that, but also make sure that we're doing what we can to get our communities prepared as well. Nationally, in the United States, we've had more than 2.1 million cases, which is about 500,000 higher than it was 3 weeks ago, with about 117,000 deaths. As businesses continue to reopen and life slowly returns to a new kind of normal, cases are surging in a number of U.S. states. Arizona and Texas reported record highs and daily numbers of new cases. 10 states have seen coronavirus numbers surge more than 50% in the past week compared to a week earlier. Those are Florida, Oklahoma, Hawaii, South Carolina, Alabama, Arizona, Oregon, right near us, West Virginia, Wyoming, and Montana. 21 states are seeing upward trends and newly reported cases, balanced by 21 states that are seeing a downward trend. While Washington is one of the 8 states that had been seeing a steady number of new cases, we're starting to see an uptick. So this, Jeff didn't include this in my talking points, but that you'll see a new report coming out from the Institute for Disease Modeling, probably at the end of this week or beginning of next week, saying an uptick in the R0, particularly in Eastern Washington, but also here in the Puget Sound as well. And the delay time for those suggests that that uptick is due to probably Memorial Day, people sort of lifting up the restrictions and sort of loosening their behaviors over Memorial Day. We have not seen an uptick due to protests and mass gatherings. but there's a lag time, so we aren't quite sure whether or not we expect to see that. And I think the reality is that we just don't know at this point why some states are seeing upticks and others are not. And so continuing to monitor the situation and make sure that, that we are prepared for a resurgence of cases either in the short term or later in the year is really essential. Shoshanna is calling my attention to questions. Okay, someone said, can we please address the questions about the article before moving? It's not an article, it's actually a radio interview, but yes, before moving on to COVID. So I'm looking to see what are the requests. One person pointed out, one of the ways to think about Breitbart is that you provided content that allowed them to get ad revenue. Will you commit to a public donation to BLM Planned Parenthood? Absolutely, absolutely. I'm totally happy to do that. The other person says, this is extremely disappointing, being pleasantly surprised they ask for normal questions is disrespectful to the hate speech that the platform is known for. We cannot selectively engage with white supremacists. Beyond taking the article down, we need to have a complete overhaul of the communications practices and policies. How can we prevent this from ever happening again? What are your plans for developing an anti-racist communication plan? Yes, so our team, including me, will undergo anti-racist training because we're implementing universal anti-racist training. And I would welcome to hear from you guys in terms of specifically what an anti-racist communication plan means to you. So I'm happy to have that conversation. Jim says, this is a real issue. How do we speak to these audiences without appearing to endorse the messages and values of the organizations with racist, unethical, financial interests who work harms to people and undermine the goals of public health? Agreed. And I do look forward to continuing the conversation. So I answered that one. Someone would like me to apologize more directly to students. Yes, that I completely agree that it was inappropriate for that news item to be in the same newsletter as the events of the last several weeks and the support of Black Lives Matter, and we are having that conversation. As part of ongoing work to become, so yes, students, I apologize. I cannot tell you how deeply I appreciate that people spoke up and said that you were unhappy. I'm not happy that you're unhappy. I wish I had not done something to make you unhappy. But yes, we are listening. I am listening to you, and I am learning. And yes, we will respond. Okay. Oh, good suggestion. Get in touch with Seattle Association of Black Journalists. They may be able to consult on anti-racist communication practices. We will do that. Okay. So I have on my to-do list, me complete the anti-racism training. I'm making a personal donation to one of the organizations that was mentioned, and I will take a look at them, but let's say tentatively, I would say Black Lives Matter, happy to do that. And continue to have this conversation, and we will reach out to I'm sorry, the link just disappeared off of my screen, off to Seattle Association of Black Journalists to work on an anti-racist communication plan. So, and yes, I'm hearing you, we are listening, and I do appreciate people bringing it up and bringing it up right away. Okay. I think we got to those, so I'm going to move on to what do Americans think of the pandemic? Key findings from a recent survey was recently shared. This was by the Gates Foundation. So what we see from that survey is that fewer than half of the public or teachers support schools reopening without a vaccine. That being said, there is a huge amount of vaccine hesitancy still in the United States. At least a quarter of the U.S. public saying that they have concerns over whether or not they would get a vaccine if there were one available. There's still strong support in some areas for social distancing, but a big divide between different parts of the country, and in our case, different parts of our state. There's a great article in the Seattle Times today talking about the situation in Yakima. So Yakima County right now is having a surge of cases and starting to see overload in their healthcare system. And yet people are feeling like they're being silenced if they even talk about COVID or themselves or loved ones suffering from COVID-19. So we do have a lot of work to do in this area as well. So Washington State Department of Health is currently reporting over 1,200 total deaths with 5,915 hospitalizations to date and more than 26,000 confirmed cases. About 480,000 tests have been conducted. That's an additional 150,000 just in the last 3 weeks. As a result of the more extensive testing, the percent of positives coming from those tests is down to 5.5% overall compared to where it was a couple months ago at 8.5%. That is a great trend. And if you aren't following the Department of Health dashboard on this, I would strongly encourage you to go and check that out and continue to monitor it, because we do have a pretty fluid situation still in the state. Governor Inslee's stay home, stay healthy order expired on May 31st. And so we are now in the Safe Start plan. 11 counties are now in phase 3. No counties have yet moved to phase 4. Those counties that are in phase 3, it's worth taking a look at the map to see where they are. They tend to be counties that did not have very many cases to begin with and don't currently have significant transmission or any transmission. We still have 22 counties that are in phase 2. 3 counties in modified phase 1, that's King County and 2 of our neighboring counties. And then we still have 3 counties, including Yakima County and Benton County, and one of the other counties that's neighboring them that are in phase 1 that still have really high numbers right now. King County applied this week to move to phase 2 status. My understanding is that that has been approved and that we will formally move to phase 2 here in King County on July 5th. And for those of you who are wondering what that means for us, not a lot is going to change in terms of our own workplace practices within the School of Public Health between modified, well, phase 1, modified phase 1, and phase 2. As has been the case, the only people who should be coming back physically to work during phase 2 or phase 1.5, as was the case in phase 1, are people who cannot work from home and who are willing to work on site, who do not have reasons why they do not want to work on site. And those people must have in their unit a COVID-19 prevention plan for the workplace that has been completed and approved. So that is a requirement from the governor's office, that employers have work plans that explicitly state how the workplace is making sure that social distancing is being adhered to, that people are being screened or attestations are being used, that there's appropriate cleaning going on, that people are adhering to mask protocols. And at the University of Washington, that is then pushed down to the school level and the department and lab level for those units that have laboratory research that has to be performed on site. So as of right now, my understanding is the only groups within the School of Public Health that have gone through that process are individual research labs and the Department of Environmental and Occupational Health Sciences has gone through that as a group, and as opposed to having each of their labs do a separate plan. Even if your work is in a laboratory and you have to be on site in order to do that work, if you are not comfortable with working on site, you will not be required or forced to return to work during this phase. So I just want to make super clear, I have continued to get queries from people who are concerned about, as we move into phase 2, does that mean that I'm going to have to come back to work on site? And the answer to that is no. We are actually still encouraging people to stay home if you can work from home, because it's we're not really ready in terms of the workplace protections, and also the governor's plan really still emphasizes continuing to maintain social distancing through telecommuting where possible. So given that phase 2 is starting on July 5th, you can, because each phase needs to last for at least 3 weeks, the soonest that we would be moving to phase 3 would be the beginning of August. So there will be, we'll get to some discussions and a little bit of an update from Uli about moving to the new building. There will be opportunities for people to come in and pack up their stuff to go to the new building. But if you're not comfortable doing that, we have workarounds for that as well. So I just wanted to make it super clear that we are doing what we can to make sure that there's a safe workplace. Before we transition to phase 3, there will be a formal plan for the entire school in terms of how we will be managing COVID in the workplace. That includes trainings for people who are coming back on site and extra precautions. But we are very committed to making sure that we are providing you with a safe workplace. Okay, so with that, I'm going to transition to updates from Uli about the new building and the timetable for what we know at this point about the timetable for the move and the process, and when you'll be getting more information about that.
Okay. The building is almost complete. The building is scheduled to be completed by the end of this month, maybe in the first week of July. The month of July is going to be spent putting new furniture into the building, setting up all the workstations. which means that moves will be slated for August into the new building. We won't move as a single block. We'll be moving as individual units depending on what building you're in today. Our moving crates will be delivered, I guess, to the existing place somewhere around July 27th, 28th, which will, and our moves are slated to start August 10th through the 22nd, which means that you'll have about 2 weeks to pack up your gear. As Hilary mentioned, we will almost undoubtedly be working from home still at that time, which means that we'll need to schedule some times for individuals to come in and pack up their gear, try to do that in a way that keeps us appropriately distanced while we do that work. Again, depending on if for some reason you're uncomfortable doing that, we will figure out how to get your materials packed up so that they're ready to move. The move schedule starting on August 10th will go in the what I call the from buildings where you are today. So all of F wing will move, and then all of H wing will move, and we will be moving people into wherever they go in the new building, as opposed to trying to move all of health services at once or all of epidemiology at once. The move, the computer gear, screens and computers and whatnot will be moving at the same time as the boxes. We will do some setup of the computer gear as needed to help people retain remote access. That varies a little bit by group what needs to be done. But following the move, there will be a cleaning of your space so that as you come back to unpack, you will have some assurance that the spaces have been cleaned post movers and other people dealing with these possessions. We'll then ask that you come back, unpack your materials into your workspace, put things away, and look at your workspace in terms of whatever adjustments need to be made. There may be whiteboards or something that didn't come across in the move that we have to deal with. So we'll ask you to do all of that, and then we'll ask you to go back home, because likely we will still be working from home for much of August. Now, again, that's subject to change, and maybe we'll see what happens as that changes for all of us. We are also working on the plan for resuming in-office work, and that plan will take into account whatever social distancing measures, whatever mask wearing, surface wiping measures that we need to. And as many of you know, with the new spaces in the building, there are more open spaces than we're used to, and there are more shared spaces than we commonly have in other of our current buildings. So we will be trying to figure out how to appropriately space people, again, depending on where we are in which of our, or where we are in what phase of a governor's plan. That may involve some shift work. It may involve spreading people out. What we will do is do the best we can with the building. I mean, as with all the buildings on campus, it's not easy to change their configuration quickly. So we will be looking at making whatever accommodations we can to make it work. So with that, I would take questions. I know takes a while to type some stuff, but that's the building update.
Okay, Lee, we have some questions about the moving update. One person said, can you please repeat the timeline for moving in and packing up desk spaces?
Yeah, the earliest right now that our moved crates will be delivered to existing locations is July 27th, 28th. The earliest that we have any of the groups moving would be August 10th. Um, and some are moving as late as August 22nd. So there's a schedule that will be circulating soon so everybody can see where they are in that, but roughly 2 weeks in the shortest period window to pack up, to come in, pack up your stuff and move on, or get them ready for moving. And that would include things like if there are file cabinets that need to be packed up. We're greatly encouraging everybody to digitize as much as they can before we move, but given that nobody's in the office at the moment, that's a little bit harder. So that's the time frame.
And Uli, there are a couple of questions about how we're going to handle social distancing and shared spaces in the new building. Do you want to talk about the work group that you have working on our plan, and also offer that if there are people that want to participate in that, that they should reach out to you?
I would say those things, you just said them, so I think that's good. We do have a work group that we're looking at trying to, I'll call it reintegrate ourselves with the building, with all buildings on campus, and largely the school administrators and others are sitting in on that. As Hilary says, if you have an interest in working on that, by all means, send me a note and we will start we're developing the plans as we speak. It will take us at least a couple of weeks to get even the draft of something together that we then will circulate for much broader discussion. I think we're very open to the notion that even as we move back into the building, we will be trying to figure out accommodations that make it safe for everyone to be in the building. And we know that means that not everyone will be in the building at the same time as well. So, and some people will continue to feel more comfortable working remotely.
Yeah, I would particularly say that one conversation we had in the chair and department admins meeting is that we don't, that we need some representation on the work group that's working on the plans for our unit for reopening, that are folks who are who are scheduled to sit in open spaces. Because there are more challenges associated with how to ensure a safe work environment there, and we want to make sure that we're hearing your voices. So if you are one of those people and you're particularly interested in contributing to that work group, please do reach out to Uli about that. I saw a suggestion from Stephanie that instead of going on with updates, that because we're still seeing stuff coming up in the Q&A, that we go back to more questions about the Breitbart interview, which I'm happy to do. I also feel like it would be helpful. Someone was commenting that it seems rushed. It's very hard to do responses in this type of format where it's just me talking at a blank screen where all I see is myself. And so I guess I would say at this point, if there are individuals who would like to speak, Shoshanna says she can try and unmute you. So if you would like to speak, if you could, so it's not just us answering one-line these questions, I'd be happy to hear from people. So if you want to speak, if you can raise your hand, someone says, yes, I think you can promote people. If they raise their hands, if you could raise your hand, we will try and figure out how to do that. Rene, I see a hand raised. Shoshanna, can you figure out how to promote her? Her hand went down.
I'm sorry, which Renee had their hand up?
I don't know, I saw it sort of flash by and then it disappeared. By the way, for the anonymous attendee who said if they're white faculty or staff who are remain silent, they have not remained silent. That is how I heard about it. So how I heard about people's concerns. So they are speaking up, which is great. Does anyone want to actually like verbally speak up, have a conversation?
Hey, Hilary, someone put in the Q&A that some people may not feel safe speaking because of a fear of being
I totally get that. I totally get that, Janet, and that's totally fine. I'm just, if you want to keep with anonymous messaging, totally fine. I'm just saying we will try and figure out how to do it if people want to talk. Victoria, do you want to say anything?
No, I mean, I think just kind of listening here and just trying to keep up with all the questions myself, you know. It's really a very challenging situation. I think personally for me, if we could not do any more of these interviews, that would be great. Moving forward, I think there's a
Totally fine. I'm totally committed to doing that. Yeah.
I would love that personally, so.
Yeah.
Looks like we have another hand up. Oh, it's Dr. Jim.
Oh, and Renee said she just made a mistake. Jim, did you want to say something?
Hello, can you hear me?
Yes.
Yeah.
Okay, great. Since I totally understand why people are not coming forth because of concerns and all that kind of stuff. But I think what I was writing in the chat is that I don't know anything. I've not seen the interview, and appreciate your transparency and work with the community and take the input. Yeah, that's true leadership in my mind. So I just wanted to say that this is really an important issue. The bigger issue is how do we, as public health people, professionals, reach a group of people that have drifted away from science, and not only are drifting away from science, but there's a smaller group of people that are simply just white supremacists that are using the media and the levers of government to promote things that we, not only from our public health values, but personal values, oppose. And then our colleagues are harmed by it because they are people of color and other people that simply just are sick of living in a racist society. But how do we as public health people, this is huge. You know, we can't just cut off that group of people. I struggle that with my personal life, with family, and you know, I'm a scientist, so I try to explain things by science, and that doesn't work. So it's a bigger conversation, and I appreciate this coming up because I think we can learn a lot from it.
Thanks, Jim. So I'm seeing some comments about wanting something more beyond just deleting the link. And so I think we did talk about a couple of things. I am also welcome, you know, I also welcome other suggestions. Okay, someone says it would be a better idea to approach a less radicalized audience that has leanings away from ours. Yeah, so I mean, I agreed. And I think, you know, this is one of literally dozens of interviews about COVID-19 that any number of us have done over the last several months. And yes, we are trying to reach many audiences. So agreed, yes. Most of the time, the vast majority of the time, those audiences are what you would refer to people who are not as far away from us. Jessie, did you want to say something? I see that you have been promoted.
Yeah, if I could say, so Breitbart has been explicitly and openly a white supremacist news organization, not even news organization, for years now, and they've been recognized as such for a long time. The push to defund them by pressuring companies to stop advertising with them has been really important and really a model for the way to do anti-racist work through media and communications. So I think it's one thing to say, well, we need to reach people who don't necessarily believe in science, and another to say, okay, you know what, we do, but we have to do that in a way that doesn't put money in the wallets of white supremacists, which is what's happening here. Every time someone searches for your name now, they're going to find a link to Breitbart, and they might click on it, which will put a few cents into those ad coffers. And I think there's potential for ongoing damage there. And the other point I would make is that, yeah, we do need to reach those folks, but they don't come to Breitbart to engage in good faith with scientists. That's not why anyone goes to Breitbart. It's where it's an echo chamber. So we need to find places that aren't echo chambers to make those really important points. No one's engaging in good faith with scientists on Breitbart, and trying to force it just enriches white supremacists.
Yeah, so, you know, and this is where I am learning from you. I had not thought about it in the context of enriching them in terms of providing content for them. I genuinely was thinking of it more as public health messaging. I guess I would take issue with that they aren't engaging in good faith. I think there are many issues, including ones that are very important to us around racism and equity, where I would totally agree with you. You know, perhaps it was just an extreme anomaly, but I did feel like in that conversation that they actually were engaging in good faith around conversations about how COVID is transmitted and what individuals can do to protect themselves and others, and to be responsible in terms of managing it. So I guess I would just hesitate to say that that there's no chance that they would engage in a conversation with scientists. I think that that is where they actually were listening. But that none of that negates. I still completely understand the other points that you have made and accept them, and having had them explained, realize why people feel so strongly about it, and will not do another interview with Breitbart, and will make a donation to try and counter it and understand why people are upset. But I guess I would just say, like, I still don't want us to, as a public health community, to completely give up on communicating with segments of our society in areas where we can make a difference. I would agree with you. I would not engage with them about a conversation on many, many, many topics. but I would like for us to continue having conversations about how do we engage with a broader spectrum of people around public health issues. I'm going to ask, since we seem to have hit a long period of silence, do any of the other assistant or associate deans want to do updates? Or do you want to call it quits for today?
This is Lisa. I would actually, I have my update can be written. It seems like this is perhaps not the time for a research update.
Okay, so perhaps put in the talking points.
Yes, I'll do that.
Okay.
Yeah, and this is Stephanie. I will do exactly the same. I'm really, there's so much that I want to say, and I don't even know what it is that I want to say. I'm really working through this, and I appreciate the patience of trying to think about what this means. And I know our initial reaction was, this is an opportunity to correct misinformation and intentionally misleading information. And now I see that it's so much more than that. I think that, so my silence and my hesitancy shouldn't be seen as me aligning for or against anything. It's just, I need to absorb this. This is new information, not new information to me. This is a new reaction and a new way to think about this action. And I really need the space to grapple with it and to absorb and process it. And I absolutely hear everyone. And I'm sort of surprised that I didn't come up with this on my own. Like, you know, it's an evil organization that pumps hate. But the initial response of, God, what an opportunity. Like, we never get to talk. We are so used to talking to people that align with how we think and we believe that we're just used to do that. We're used to doing that. We're so programmed to do that, that an opportunity to speak to somebody else who actually is very clearly racist and anti-public health is like, this is fascinating. This opportunity is fascinating. And now I see the damage and the hurt that comes along with that. So I apologize for being sort of complicit and not thinking about this before it landed in my inbox this afternoon.
Yeah, I mean, I'm grateful that we have gotten to a point as a community where people, I can speak up and say and express their unhappiness and obviously we know everyone is hurting, and it is far from our intention to amplify that hurt right now. But I appreciate people's patience in sort of explaining the perspective. And I agree with Stephanie. I mean, it's one of those where my initial reaction was, like I said, no way, but for different reasons than the reasons that you guys have articulated. I think it was, so it's very helpful to hear people's perspectives, and certainly I genuinely, I'm sorry for pain that it has caused people at a time, pain ever, but pain at a time when people are particularly feeling hurt and exhausted. So with that, I am going to suggest that we end the webinar today. happy to have follow-up conversations with people who would like to have follow-up conversations. I'm not requiring you to do it, but if you'd like to have one, I'm happy to have that conversation with you. And again, thanks to everybody for your input and suggestions.